My name is Dr. David Jones, and I am a dentist at Omni Dental in Council Bluffs and in Carter Lake, Iowa. I'm here to talk about snoring and sleep apnea. Snoring affects 24% of women and 40% of adult men, and snoring is not normal. It occurs when the airway narrows, causing air to be inhaled at an increased speed and pressure. This makes the tissues in the back of the mouth and in the throat vibrate and produce a snoring sound. Snoring can be treated by your dentist, but it may be a sign of a more serious problem called obstructive sleep apnea. Sleep apnea is a chronic illness in which breathing actually stops repeatedly during sleep. This happens when the soft tissues in the back of the mouth and the throat narrow more than they do during snoring, and the airway actually becomes blocked, this is what stops breathing. This can happen for 10 to 30 seconds at a time, and it may occur hundreds of times during the night. People with sleep apnea are literally choking to death every night that they sleep. Sleep apnea is the most common chronic illness in our country. It's estimated that more than 18 million people have sleep apnea, and that 80 to 90% of those people have not yet been diagnosed. Sleep apnea is life-threatening, and it can lead to a premature death. It can cause high blood pressure, heart attacks, strokes, diabetes, memory loss, depression, and acid reflux, along with several other health problems. People with untreated sleep apnea also have a 6 times higher rate of cancer than people that don't have this condition. Overall, untreated sleep apnea can cut your expected lifespan in half. These staggering statistics, along with the fact that we can help treat sleep apnea, has led our practice to begin screening our patients for sleep apnea. We are doing this by checking our patients' blood pressures, inquiring about snoring, and checking our patients' neck sizes. These 3 things are the top screening indicators for sleep apnea. We're also using a short questionnaire to help us screen for sleep apnea. If we are concerned about sleep apnea, we may recommend a home sleep study or a sleep study completed at a sleep lab. If a sleep physician diagnoses a patient with sleep apnea, we can then discuss options with our patients for treatment. These options may include surgery, wearing a CPAP mask, which is a hose and a mask that forces pressurized air through the airway to keep the airway open. Or we may suggest a dental appliance. This helps hold the lower jaw and tongue forward during sleep. This will also help keep the airway open. This is generally the most conservative treatment and one of the most effective, and also one of the most comfortable for our patients. We can also treat snoring with one of these appliances if our patient does not have sleep apnea. So if you or someone you know snores, I encourage you to speak with your dentist or physician. It could be a life-saving discussion. Thank you.